we'll come to what Chandrababu Naidu has said, but I am going to ask you that is this problem only peculiar to the southern states, Srinivas Goli? Because I have read many articles and everywhere there is mention about how most of the southern states are at a risk, Srinivas Goli.
Yeah, this problem of fertility decline is now there across India, except three states: Uttar Pradesh, Bihar, and Madhya Pradesh. Even Rajasthan and other states, Jharkhand, all other states now. If you look at the new figures, they have especially the urban areas, we have low fertility. Even I say that Kolkata, urban West Bengal, urban Jammu Kashmir, and urban Himachal Pradesh have only one children per woman, like 1.1 TFR. That is much low according to the latest Office of RGI report from the sample
For the
basis tracing.
benefit of the viewers, you know, because I was giving them a history, because at a time when India, you know, it was put under family planning, did not policymakers think that there may come a situation like this, much like, let's say, Japan or, you know, South Korea, where we always saw that, you know, depleting population or couples not having children was a major issue there. And therefore, a lot of us went as labor to work there, amongst other reasons. This is not the main reason. What happened though? The policymakers were myopic, were they, Srinivas?
Yeah, see, the demographers have been warning about the coercive measures or the fast like the fast decline in fertility or the universal like convergence of fertility decline across the states. But you know, we cannot talk about like whether the policymakers are not aware of this fact, but the demographic community have been informing about these things, like about the faster decline of fertility rate in a country like India.
Okay, just for the benefit of the viewers, when you say decline of fertility rate, does it mean the choice exercised by a couple to not have children, or generally the inability to have a child?
No, not inability. This is the choice. The
Okay.
choice that now more and more people want low children, and even now, whatever the total fertility rate that you generally use, average number of children per woman, that is based on overall children. But if you look at even only wanted children, that is even much lower. Like, even if you look at the state like Bihar, Uttar Pradesh, and Madhya Pradesh, which are currently now ranked as high fertility state based on the overall number of children, but even in those states as well, if you only calculate the total number of fertility rate based on the wanted number of children, that is NFHS National Family Health Survey do that exercise, and they ask the question, out of total children, suppose they have 3 children, out of this how many would you have wanted if given you have taken the decision, or you according to your
All right,
choice.
Srinivas, just
If you,
hold on. Let me come back to you, because we also have Professor Jyotsna Tirunagari, National Spokesperson for the Telugu Desam Party. Professor, a very warm welcome to you. Namaskar. I want to ask you that, you know, Chandrababu Naidu has repealed the two-child policy now. He is encouraging people to have more children. I also want to ask you about one statement which I will reserve for later. But right now, tell me something, Professor. Much like this country underwent a lot of turmoil and difficulty in trying to control population, if you remember in the early 70s, throughout the 70s, convincing people to have less children, what is the plan that Andhra Pradesh has to encourage people to have more babies? It's not that you snap and it happens, right?
Absolutely not, Sudhaji. And we are not saying you snap it and it happens. We are talking about a dynamic situation. The situation, what we call, sometimes हम लोग ये बोलते हैं ना, need of the hour sort of a thing. If you remember in the 90s, it was the same. I'm just not quoting about Andhra Pradesh in particular, but most of the South Indian states, if you remember,
Yes.
two-child policy, and because when there was a population, I would say a surge at that particular point of time, we were the most successful states in implementation of population control measures. And now there is a situation wherein there is the disparity that is seen. If you remember, if you see, there is an economic impact on the states. There is
Yes.
a declining fertility rates in the states, and a growing elderly population in the states. And I do not want to term it, but there is a declining younger population in the state, and there is a reducing what should I say, working age population in the state. So a lot of things. So it needs to be handled during that particular point of time, when there was a population surge and there was an impact of it on the economic situation of the state and the country on a whole. We South Indian states on a whole, I would say, reacted to it, and we acted very positively, and we said there has to be some control on it. And we I think Andhra Pradesh and Tamil Nadu and Kerala, I suppose, were
Sure.
in fact Karnataka also were the most successful states in implementing the population control measures.
Yeah.
Now, in this age, in this particular situation, now there is what we see is um, a situation wherein the
Yeah,
population. A couple of things I have mentioned, Sudhaji.
Yeah,
So we
Professor,
have
also, the delimitation, of course, politically, it's going to come and bite you, because we know that. And you're right, you're not just Andhra Pradesh, Tamil Nadu. Stalin has also spoken about it. He spoke about blessing. We used to have blessings where we would be blessed that Saubhagyavati Bhava, and also have 16 children at one time. I mean, impossible, but that's what Stalin says should come back. How is it going to be possible? I'm asking you a question. Unless you
Sudhaji,
have a robust plan. And let me finish, there has to be investment in education, in healthcare,
yes,
in
yes,
family, in
yes.
childcare. There has to be social cost. This thing is not going to happen. So are you working on it, is my question.
Absolutely, Sudhaji. And let me put it point blank here. We have no political, political agenda behind it. Let me put it point blank. Unlike other states, Andhra Pradesh and Naiduji do not have any political agenda behind it. It's
All right.
because we see a economic impact on our state. We
Right.
see an impact on our younger
All right.
generation. We see an impact on our
All right.
demographic. That's the
Yeah.
reason we are
Yeah.
talking about
Yeah.
it.
Yeah.
And when it comes to Andhra Pradesh, Sudhaji, just give me a moment. When it comes to Andhra Pradesh, yes, all the things that you have spoken about with regard to healthcare facilities, with regard to women education,
Yeah, I'll
with
wait
regard
and
to
watch,
child
because he
education,
said
everything,
policies. You can't
everything,
just,
we have
no, you
policies.
can't just repeal something and say have more children, because it's
Cannot say.
decades of thinking. Srinivas Goli, with more and more women coming out to work, with more and more families becoming nuclear families, with zero child care in any part of this country. I have seen it, I have suffered it. I'm sure, Professor, also, unless you live in a joint family. We are working women, it is very difficult. Tell me, Srinivas Goli, how is it going to be possible if you tell someone who's much younger than me, at least have 3 children, they will stare at you almost ready to kill you. They'll say either I keep my night shift job or I have a baby. Tell me, without all this support, how are you going to do it, Srinivas?
Yes. Fact.
Josna ma'am is talking, some of them are correct only. We need to agree with some of them. But yes, one point is that the fertility cannot be reversed. It back, whatever, like this is repealing this two-child policy. Around 13 states and union territory implemented it, and immediately 4 states, even in the year when they are implemented around 90s, already 4 states have repealed it that time, and Andhra Pradesh quite late to repeal it. But I am not going to that point. But reversal of fertility is only possible when you bring gender egalitarianism. Without that, the reversal is impossible. Many countries tried with low, even not just not having any two-child policy kind of plan, but with a lot of incentive.
Exactly.
Incentive.
So talk
Mm.
about gender egalitarianism. A lot of viewers may not even,
Yeah, gender
understand.
egalitarianism means like men's role in the just not outside, like course, like in terms of earning the income or providing the protections to women, taking them to hospital, not that, but it's also within the household, basically sharing the household chores and sharing the child care
Exactly. Yeah.
responsibilities, maternity care
Yeah.
responsibilities.
Yeah.
Because
So what
that is,
Srinivas you're saying, Srinivas, what you're saying
yeah,
is that is still not changed in Indian households, where
no,
the
no.
major burden of running a house, going to work, coming back, taking care of in-laws, all falls majorly on the woman of the house. And family earning maybe not so much that you can also employ help. Let me come back to you. Jyotsna, I want to ask you one question. Chandrababu Naidu garu has also said that these days there are lots of couples who just want to enjoy the money that they are earning. That's a choice. Like I have 2 children. That's a choice I make. You know, my people wanted me to have 6. My choice is no, 2. That's all. So I'm saying, what is this statement coming from? You know, it's actually it's a statement on me and also my husband. Maybe we don't want to have children. What's wrong with that? Saying they just want to enjoy their own money. Don't you think, Jyotsna, that's a very, very objectionable statement?
See, Sudhaji, I'll tell you, I also have 2 children. In fact, Lokesh Garu has a single child, and Lokesh Garu is the single child of Chandrababu Naidu ji. So you can also, you know, if you want, if that is the case, that it, you know, if it has to be implied on, it can be implied. But the only thing Naidu ji said was the psyche of current generation. What is happening is we have to think on a multifaceted angle, which we are not doing. It's a fact. Today, many of my friends, my own friends, Sudhaji, forget about any others. My own friends say, I don't want to have babies. I want to have pets in my house.
Yeah,
We
so
have seen that. I'm not
so
denying
what?
that. I'm not. Sujaji, let me come back to the point. When Naiduji spoke about it, it was in a larger context. It was not
Arey, you
directed to
have to
everyone in an
start, you
example
have to
person.
incentivize people, Jyotsna. You
That's what
have
we
to,
are doing.
but
That's what. Let me complete my point, Sudhaji. Let me complete my point. Yes, when Naiduji said that, he also spoke about certain policy decisions that has to happen from the state as well, whether it is tax incentives or childcare subsidies. Yes, you were talking about it. Yes, I also suffered. You also suffered, Sudhaji, because we are in a field where we require some help and we need to invest in healthcare. We need to invest in education,
just one
both
minute
for women
left.
and
Yeah,
children.
yeah,
Yeah,
okay.
and children. And yes, there is a need for a change in the current society. That's
That's
what we are
what
talking
governments
about.
have to do, not
What-
people. Srinivas
And yes,
Goli, I have the I
we
have
from the
one
Andhra
minute left.
Pradesh, the
Come on,
government of
Jyotsna, I
Andhra
have to
Pradesh.
give them others. Just a
Ma'am,
minute. You know, Srinivas
You don't
Goli,
take.
yeah, yeah.
how do you reverse the thought process is my entire, these people who are saying dinks, you know, double income, no kids. This is what they've grown up with. We've lost
Yeah,
that time. Wouldn't you agree?
yeah, ma'am, there is a, like, Maslow's changing need theory. Now people are not looking for basic needs, ma'am. They are looking for higher end needs,
Yes.
self-satisfaction, self-esteem,
True.
self-actualization. Okay. So, ma'am, Josna, ma'am, just if it all like, because I'm a big fan of like, sir, since is combined Andhra Pradesh days. So I don't want like, and he might spoken with a lot of wisdom only. So one thing, ma'am, if you really, especially being a Telugu, I know what I want in my state as well. So basically, ma'am, two, three things like, the fertility rate declining because the age marriage is going up. So why people are going for a high, or like why people are marrying at very high ages, ma'am? One reason is not just education, ma'am. People are waiting to get a decent jobs.